How positive are you? Whose antibodies are they anyway? Factors known to cause false positive HIV antibody test results. I know this is a really big deal in Africa, where more women test positive than men. Wonder why? Birth control pills, of all things, can be a factor and cause a positive test. Moreover, when you give Africans who already suffer from traditional African diseases, when you give them antiviral therapy like ACT and its offshoots, you make them transfusion dependent, and that means they die. Moreover, in Africa, it is possible to get an AIDS diagnosis just based on symptoms. Quote, this patient has tuberculosis, that one chronic diarrhea, this one malaria, and that one leprosy. All diseases that have been known in Africa for ages. But then everything was re-diagnosed as AIDS out of fear of AIDS. Neville Hodgkinson, quoted in Virus Mania. Consider this academic article where it says the following about what can cause positive tests. The AIDS establishment, and I quote, has managed to convince many people that the HIV antibody tests, ELISA, FIA, Western blot, are 99.5% accurate. In this article, Christine Johnson from Heal Los Angeles lists conditions documented in the scientific literature known to cause positives on these tests and gives her references. It is expected that this list will generate much discussion and dissension. For the time being, a few clarifications should be made at the outset. Just because something is on the list doesn't mean that it will definitely or even probably cause a false positive. It depends on what antibodies the individual carries, as well as the characteristics of each particular test kit. For instance, some, but not all people who have had blood transfusions, prior pregnancies, or an organ transplant will make HLA antibodies. And some, but not all, test kits, both ELISA and Western blot, will be contaminated with HLA antigens to which these antibodies can react. Only if these two conditions coincide might you get a false positive due to HLA cross-reactivity. Some things are more likely than others to call false positives. And you know, this issue of tests for diseases, this has come up a lot recently in the current global health circus. And we can see that, I don't know how much I should say, how much I'm allowed to say, because I've gotten in trouble before on YouTube for opening my mouth. But AIDS was an antibody test pandemic, and what we're seeing now is a PCR pandemic. But a lot of the parallels in terms of the unreliability of the tests would make one wonder if HIV/AIDS was a dress rehearsal or a warm-up for what we've been dealing with in this situation during the last couple of years.